Hi, my name is Jennifer Steverson and I'm doing the debriefing for the simulation video. The first question is, tell me where you saw caring exhibited in the scenario. The place where I saw caring exhibited was when the nurse provided the patient with extra supplies. Even though it was a policy of the hospital, the nurse did provide those supplies to the patient, and she also did take the time to show the patient how to change her baby's diaper because she wasn't sure of those steps. Second one is, tell me what behaviors you observed that were not caring. I felt like the nurse was very rushed in trying to get the discharge instructions given to the patient, and therefore that was not showing caring. And the member asked a few questions or made statements that the nurse did not explore further. Like she said that she did not have a home to go to. She also inquired about narcotics with a history of a known drug user. So those are things that if the nurse was displaying caring, she would explore those comments a little bit further. How I would respond to this situation is when the patient said that she was homeless, I would have explored that more, possibly gotten case management involved, and discussed where she was in fact going if she did not have a home, what that environment was going to be like, and explored that a little bit more. I would have also discussed, when she was inquiring about narcotics, I would have probably discussed that with her, discussed her pain, proper pain control, and explored that a little bit more so that she felt like she was ready to go home without those narcotics. The priorities in the scenario, from the patient's view, her priority was getting her pain medication. And from the nurse's standpoint, I felt like her priority was just getting through the discharge instructions because she was busy and had other patients that were needing her attention. Resources that could have been offered to the patient, I feel like case management would have been a huge resource to be offered to the patient. They would have been able to explore not only the drug dependency issues, but also her homelessness. How will I transfer what I learned here in the practice setting? I think that what I will do going forward is slow down. I think we tend to feel rushed because we do have patients waiting for us, but we can't just look at something like discharge instructions as a task. We need to make sure that our patients understand what they need to understand before going home so they can be safe and they won't come back into the hospital. So we really need to take our time, and that's what I'll do. I'll start slowing down and making sure the patient gets everything they need. Thank you.